Hi, my name is Janine Mohamed and I'm a proud Narungagana woman from South Australia, and I'm also the CEO of the Lowitja Institute. Like many of you, I'm working from home, physical distancing, but in my case, I'm here in Melbourne on the traditional lands of the Wurundjeri people of the Kulin Nation, whom I pay my respects to, elders past, present and future emerging generations. Now, I know the corona pandemic is really tough times for our people and, of course, our communities, and this message is for our mob, and to also say that we are with you and that we are so grateful for the tireless and dedicated work of our Aboriginal Torres Strait Islander health workforce and, of course, our Aboriginal Torres Strait Islander health services. We're always proud of them, but we are particularly and especially proud right now. And we hope that non-Indigenous health services will also listen into this message. Last night, the Prime Minister urged three main groups of people to stay at home. Those Australians aged 70 years and over, those with chronic diseases aged 60 and over, and Aboriginal Torres Strait Islander people aged 50 and over. Now, this tells us a terrible story of health inequity in this country, and that Aboriginal Torres Strait Islander peoples are disproportionately at risk in this pandemic because of historical and ongoing systemic failure. The risks we face from the coronavirus in remote, rural and urban communities is not due to our own behaviour or our lack of care for self. It is the consequences of past policies and continuing systemic failures, and of course us being locked out of the design, development and delivery of health systems, from long ago to this very day. And it's the consequence, of course, of poor experiences that our people have in these health systems, which builds mistrust and makes us not want to go in and access these services. Sadly, we know from the Australian Indigenous Doctors Association and others last week that these poor experiences are happening in shocking ways in the midst of this pandemic. That means that this is more important than ever that our people are able to access culturally safe health services that combat racism in our health system. Because we know that when healthcare is not culturally safe, Aboriginal Torres Strait Islander peoples will not seek out the care and we won't work in those health services, and that puts us at great risk. The key lesson for mainstream health services is that cultural safety is not about learning about Aboriginal Torres Strait Islander peoples and all of our nuances as if there's some sort of tick list. It's about turning the gaze back on yourselves. It's about seeking to understand your own biases and beliefs and where they come from and how to deal with them, individually, as an organisation and systemically. It's about us stepping into our responsibility to know ourselves and do something about it. And of course, cultural safety is a lifelong journey, but it's one that really needs to be underway, at least started, if not well progressed, during this pandemic. And for more information on this topic, you can go to a multitude of organisations' website, NACHO, AIDA, CATSNM and iHeart, just to name a few. Now, thank you for tuning in. All of us at Lowitja Institute hope that you and your families and communities stay safe, stay well and look after mob.